Hello, everyone. For our presentation for professional issues and action, we will be talking about the Home Health Care Planning Improvement Act of 2015. This PowerPoint will be presented by Benson, Baldovi, Irina, Karpman, Chelsea, Scoglio, Melanie, Tran, and Alysia Williams. So the Home Health Care Planning Improvement Act of 2015 was introduced by Senator Susan Collins in February of 2015. It amends Title 18 of the Social Security Act to revise conditions of limitations on payment for home health care services. These acts allow payments for home health services to Medicare beneficiaries through referrals by advanced practice registered nurses as well as physician's assistants who work under physician supervision. Advanced practice registered nurses include nurse practitioners, clinical nurse specialists who are working with physicians, and certified midwives.
For our interview, we interviewed Christy, who provided her personal insight and experiences involving the Home Health Care Planning Improvement Act. She practiced in the neurosurgery department where she did utilize the benefits of this act. Okay. The types of patients she believed that qualified for home health services were patients who had a superficial wound infection and needed proper cleansing of the wound. Before she could refer a patient to home health services, she needed to properly assess them to see if they were not in need of a higher level of care that could not be provided at home. Higher level of care includes necessary IV antibiotics or open wounds that require continuous monitoring and proper dressing changes to prevent infections.
So we are in support of the Home Health Care Planning Improvement Act because we believe in the advantages and benefits it can provide. This act will ensure that Medicare beneficiaries in need of home health care services will be able to directly assess home health care by referral from their advanced registered nurse practitioner or physician assistant. Referrals from the ARNP or PA allows beneficiaries the opportunity of receiving continued care, which results in an increased likelihood of experiencing better health and higher quality of life. Christy, who was our interviewee, is also in full support of this act. She believes that with more patients being seen by ARNPs due to physician shortage, it is essential for advanced practice nurses to be able to function in the full scope of their role to ensure patients receive timely care.
Okay, so the major points to support our position is that by 2030, the baby boomers will all be over the age of 65. Baby boomers will make up roughly about 18% of the US population. An increased number of people greater than 65 years of age is equal to the increased healthcare needs. That accounts for a steady increase of Medicare recipients needing home health and nursing services at a rate of about 10,000 additional people per day until the year of 2030, according to Cohn and Taylor. There is a steady increase in the demand of healthcare, but a slow influx of providers. Advanced practice registered nurses provide a way to fulfill this demand by allowing APRNs the ability to certify home health plan of care. We eliminate the delay in the delivery of care to patients. It is important that healthcare providers such as APRNs be allowed to practice to the full scope of their education and training.
On this slide is a graph that WorldNet Daily presents, and it represents the aging America as baby boomers retire. By 2030, it is estimated that there will be over 72 million American citizens aged 65 or older.
The Home Health Care Planning Improvement Act leads to increased savings. The Medicare system can save an estimated $252.6 million up to the year of 2024. Without this act, there is only a projected savings of about $107 million. A study conducted by Dobson, DeVanso, and Associates showed that with the enactment of the Home Health Care Planning Improvement Act, It will save money, and it will provide for a better economic boost for the country.
Not only can patients benefit from this act, but physicians as well. Currently, locating and obtaining documentation from physicians in a timely manner is often cumbersome and difficult. With this act, it is expected that the administrative burden can be alleviated, as ARNPs will be hoping to take some of the load off. However, we expect that there will not be a full transition to non-physician home health care referrals due to institution-specific guidelines and patient referral protocols. By allowing ARNPs to refer patients to home health services, it can improve access to important health care assessments and treatments that will be provided in a timely manner. This can potentially prevent additional hospital, subacute care facility, and nursing home admissions. As a result, this bill can provide beneficiaries continued access to care and increase the likelihood that they would experience better health and a higher quality of life.
The theoretical basis for the position we chose is the Roy adaptation model, which is a nursing theory from Sister Callista Roy in 1976. This theory is based on the idea that each person is a biopsychosocial being that is in constant interaction with the environment. The Roy adaptation model is made up of 4 sections: person, health, environment, and nursing. It focuses on the individual nurse and the interrelated systems of various stimuli in the environment, such as healthcare agencies, government agencies, patients, medical professionals, degrees of sickness, and levels of care. By utilizing this model, we can explain the nature of nursing as a service to society and use a framework for decisions and nursing judgments. By promoting adaptation to each stimuli in the environment, the nurse is contributing to the patient's health, quality of life, and integrated life process to meet the patient's needs.
Hello. The action item that we chose to pursue in order to increase awareness and bring clarity to Senate Bill 578 was that I wrote and presented a PowerPoint to a group of seniors that lived at a 55 and older community in the area. Brighton Parks is an active senior community where people who are over 55 live independently. The presentation that I gave to the group of senior citizens included Home Healthcare Planning Improvement Act and which government officials were involved in the act. I also provided a summary of the bill and estimated cost savings with this act. It was also important to include the statement of support from well-respected nursing organizations such as the National Nurses Association and the American Association of Nurse Practitioners. At the end, I provided contact information for Senator Barbara Boxer, who represents the voices of our District of California. The response to the action item was that the 15 seniors that I presented this PowerPoint presentation to had a positive response. Many reported seeing a nurse practitioner in the past year, and others also reported utilizing home health care services. All 15 seniors agreed that they would support the bill, and several of them stated that they would email Senator Boxer on behalf of the bill to show their support. The research evidence, we combined research evidence from the American Association of Nurse Practitioners, the American Nurses Association, the U.S. Senate, as well as financial impact studies from DeVazio and Associates. We interviewed an expert in the field named Christy Leach for her clinical expertise. We presented our position to a group of seniors that are most likely to need these services as a form of patient feedback. And finally, we consider current legislation and how it related to our position on SB 578.
Here are our references. And thank you for watching.